Good afternoon, everyone. This is the 2025 Move to NJ Solutions Health Insurance Fund presentation for the Caldwell West Caldwell Public School District. My name is Elizabeth Roldan. I'm here with Julie Servideo, and we are from IMAC Insurance. We are the insurance brokers for the district's health insurance that includes medical, prescription, and dental benefits. We can assist you with any benefit questions or claim matters that you may be experiencing. Our dedicated team is available via email, via the phone, to answer any of these questions that you may have, as well as resolving any claim matters, such as possibly a pre-authorization matter, or if you're having a problem with how a claim was processed, reach out to us. We can certainly help you now with your benefits in the state, but also moving forward with your benefits when you move to the Horizon Direct Plan through the Joint Insurance Health Fund. You can reach our office by calling 973-450-9800, or you can send us an email at info@imacagency.com, and we will get back to you. We are very big on getting back to everyone in real time, especially now during this transition to the New Jersey Solutions Health Insurance Fund with Horizon. We want to make sure that we answer all of your questions quickly. I know that a lot of you that I met last week at Grover Cleveland Middle School have already emailed me questions about potentially moving from your Direct 15 plan to the New Jersey Educators Health Plan, and seeing how those medications that you and or your family are on, how they would be covered under that plan. The Caldwell West Caldwell Public Schools District is going to be transitioning its current medical and prescription plan benefits from the New Jersey School Employees Health Insurance Benefit Plan, or the state, as it's commonly known, to Horizon Direct through the New Jersey Solutions Joint Health Insurance Fund. This change is effective January 1st. The biggest takeaway for today, and I know I'm going a little bit ahead of myself, but the biggest takeaway for today is going to be that you will all, irregardless of what plan you end up being in, you will all be receiving new ID cards come January 1st. Those ID cards will be sent to you probably around the week between Christmas and New Year's, maybe a little sooner than that, but everyone in the district will be getting new ID cards. So that's very important that you be on the lookout for that, as you will need to present those new ID cards to your doctor and your pharmacy come January 1st. Due to this change, if you would like to make a change now, you have until November 21st to make additional changes. Any of the changes that you made last month on Benefit Solver, those changes are being captured, and that is going to be what you are going to be enrolled in unless you make a change. So for example, if during the last open enrollment period, you moved to Direct 15, but now you'd want to move to the New Jersey Educators Health Plan or vice versa, that's certainly a change you can do now until November 21st. There are no changes to your dental benefits. If you waive coverage, you must complete and submit a waiver form. If you have a dependent child that's overaged and you're part of the Dependent 31 or Chapter 375, they do need to be re-enrolled with Horizon. We have those forms on the IMAC benefits portal. Certainly reach out to us. We can also email you the form, but if you have that ongoing right now, that is something you will have to have that dependent child re-enroll in. If you, as I said, if you wish to stay in the same plan that you had when open enrollment ended last month, that you made your elections on in Benefit Solver, that is the information that's going to be loaded into Horizon's enrollment system, exactly as it appears in Benefit Solver, with no action required on your behalf. But again, this is an opportunity. If you would like to make a change now, you can until November 21st. The 4 plans that are being offered through the New Jersey Solutions New Jersey Joint Health Insurance Fund are the Direct Access 10, the Direct Access 15, the New Jersey Educators Health Plan, or NJEHP, and the Garden State Health Plan, or the GSHP. Employees who are new to the district that were hired on or after July 1st of 2020 will still be required to only be enrolled in either the New Jersey Educators Health Plan or the Garden State Health Plan, and that is a New Jersey law, or commonly known as Chapter 44. The benefits, and I know this is a question that we've been getting a lot when we were there in person last week, as well as on the phone. The benefits that are being offered now with the Horizon Direct, those are going to be equal to or better than what you currently have. So there is no change in the actual benefits that you had in the state now that you're moving to Horizon Direct. So that's a big takeaway as well. If you make a change from your direct access 10 or 15 to the New Jersey Educators Health Plan or the Garden State Health Plan, your prescription would be impacted by that. So for example, those of you that are in Direct 15 that are looking to move to the New Jersey Educators Health Plan or the Garden State Health Plan, there is a different prescription plan that accompanies those two plans. So Direct 10 and 15 have one prescription plan. The Educators Plan and the Garden State Health Plan have another prescription plan. We are going to be discussing those differences between both of those two different plans, but both of them would follow the medical plan that you choose. As I mentioned before, everyone will be receiving new ID cards for medical and prescription. Your dependents, unlike in the state, are not going to be listed, only your name as the subscriber and the coverage level. So if you have a family plan, it'll show your name and family coverage. The ID cards will be delivered and mailed to your home prior to the January 1st effective date. And please, when you get your ID card, double check that it has your name and the correct plan and the correct coverage tier listed on there. Because if there's an issue, we want to be able to get that corrected for you and have new ID cards issued as soon as possible. But again, the biggest takeaway and what we tend to see as the biggest issue when there is a transition or a plan change is that members sometimes forget to present their new ID cards when they are going either to their doctor's office or to the pharmacy. So please make sure that even if you have a procedure a procedure that's going to be done right after the first, as soon as you get your card in December, present that to your doctor's office and let them know that come January 1st, you have new coverage that's coming. After January 1st, you'll be able to log into the horizonblue.com website. And if you haven't created a member account already, you can certainly do so then. But if you have a member account already, the same login that you have now will continue to be the same login after January 1st, and it'll reflect your new benefit number. The ID number that you have will continue to follow you, but the prefix will be in the group number will be changing as a result of the transition. But again, everything will be loaded on January 1st in your member portal with the benefits at that point. For those of you that may have a prior authorization already in place, we can certainly work to get those prior authorizations. If you're in a Horizon plan right now, we can work to get those prior authorizations moved over to Horizon Direct. Please reach out to us, especially if you're having a procedure done right after January 1st. We don't want there to be a delay in how your claim gets processed, and we certainly don't want you to postpone or delay any type of care. So please reach out to us and let us know your prior authorization information. Will need the doctor's information and the procedure that's being performed after the group goes live with Horizon on January 1st. If you are someone that is currently in the Aetna plan, like for example, the Garden State Health Plan, you would need to go ahead and reach out to us because your doctor will have to submit a new prior authorization from Horizon. Horizon and Aetna don't communicate, so we would need your doctor to resubmit that if you're in an Aetna plan now because of this move to Horizon. But if you already have that pre-authorization in place under a Horizon plan currently, we can have that moved over with no need to have your doctor resubmit that. But again, reach out to us if this is a scenario that applies to you. Same thing with prescriptions. If you, since it is a new prescription carrier, you're going from Optum Rx in the state to Horizon Direct, your doctor will have to go ahead and file a new prior authorization for any medication that you may be on continuously. So please reach out to us. We'll go ahead and work with you on that. But what we like to recommend and suggest to members is that if you have a refill towards the end of the year, we highly encourage that you fill it. If God forbid there's an issue with your coverage or anything like that, we want to make sure that you don't go without your medication. So we highly recommend that you fill that last prescription right towards the end of the year so you have enough of that medication. Horizon will as well do a one-time courtesy fill if once your plan is active, if there's a delay with your prior authorization. But in either scenario, we highly encourage you to get that last fill before your Optum Rx benefits are finished on December 31st. But again, reach out to us if there's any issues with any prior authorizations that you may have in place. So as we were discussing, there are 4 plan options that are available, and one of the questions that we get a lot during this time of year with open enrollment is how the contributions are calculated and why there is such a savings by moving from the direct 10 and 15 to the educators or the Garden State Health Plan. So if you can see there on the left of my graphic here, the direct access plans are calculated, the contributions for them are calculated based on the coverage tier. So if you're covering family, single to adults, parent and child coverage, and your salary, as well as the premium. Those 3 pieces of information get calculated are factored into the calculation for your contributions. So as you can see in direct access, for example, every year that the premium goes up, your contributions also go up because it's based on a percentage of that premium. Whereas the New Jersey Educators Health Plan and the Garden State Health Plan only factor in the coverage tier and your salary. So your salary, for the most part, stays uh, constant and it goes up gradually. And there isn't that volatility of changes in contributions because it's more stable, right? So in the New Jersey Educators Health Plan, for example, you will always have a savings guaranteed compared to the Direct Access 15 plan. But again, there are plan differences. We are going to be discussing them, but it's something that we like to just showcase so people have a better understanding of why it's calculated so differently and why there's such a savings on both of these plans. As you can see, the New Jersey Educators Health Plan does have a very different contribution table to determine those per pay contributions. So if we follow this table, for example, an employee that earns, let's say, $75,000 and has a family plan, that employee would be contributing 5.5% of their salary. That number is divided amongst 20, which is your number of pay periods per year, and that is how we calculate your contribution amounts per pay. Significant savings, especially as I've been talking to teachers, the higher their salary, the greater the savings. I just connected with a teacher who earns $110,000 and her savings was close to $9,000 moving from the Direct 15 to the New Jersey Educators Health Plan. So the savings are very significant, but again, there are plan differences that we are going to be discussing. Same thing applies to the Garden State Health Plan. They have their own separate table of contributions. And with any of the 4 plans, we highly encourage you to utilize the calculator that's on the portal right now, which will determine your annual and your per pay amounts very quickly for you without you having to go into figuring out a table and the rest of the calculation. The calculator does it for you seamlessly. So as we get into what the medical plan differences are with the New Jersey Educators and the Garden State Health Plan, all 4 plans utilize the same network of doctors. So anyone who's in network now for you under Direct 15 is going to be in the network for you under the Educators and the Garden State Health Plan because all plans have the same network now as part of this move to the NJ Solutions Joint and Health Insurance Fund. The Garden State Health Plan, however, only has coverage in the state of New Jersey. That is a that is a big distinction that we like to make because especially for those of you that have dependent children away at college or that may want to utilize services outside of the state, specifically in Manhattan, for example, which I know we're so close to the border with New York City, the Garden State Health Plan does not have coverage outside of the state of New Jersey. So that's a big distinction that we like to highlight. Most people I can tell you that are in Direct 15 that are looking for a cost savings alternative will move and have moved over the last 5 years to the New Jersey Educators Health Plan because it not only has the same network of doctors in New Jersey, it has the same network of doctors nationally as well. So any of the out of state doctors, for example, in New York City, or if you spend any time in Florida or anywhere else in the country, it's the same national network for the Educators Plan compared to the Direct 15. As we mentioned, the contributions for the New Jersey Educators Health Plan and the Garden State Health Plan are calculated as a percentage of your salary rather than a percentage of your premium, which is why there's that guaranteed savings. Your copays would be $10 at your primary care, $15 at your specialist, and $125 at the emergency room, which would be waived if you're admitted into the hospital. The two big differences that we are going to be getting into great detail about is that the out-of-network, where out-of-pocket costs may be higher if you utilize out-of-network doctors because they reimburse less out-of-network under the New Jersey Educators Health Plan than they do for Direct 10 or Direct 15. And the other difference is the formulary or the list of covered medications under the Educators Plan. The list that's used for the Educators Plan as well as the Garden State Health Plan is a smaller list with a mandatory generics and step therapy requirement, unlike Direct 10 and 15. So again, starting to think about how do you utilize your medical plan if you're going out of network with any degree of frequency, as well as what medications you and your family may be on that would be an impact if you make this change. The out of network, as we mentioned, does offer a lower reimbursement amount on services compared to Direct 10 and Direct 15, but specifically acupuncture, physical therapy, and chiropractic under the Educators and the Garden State Health Plan out of network are reimbursed at a certain dollar limit. So for example, if you go out of network under the Educators Plan and you utilize an acupuncture benefit for pain management, that is capped at no more than $60 per visit when you go out of network for that service. Same thing would apply to physical therapy. That's capped at $52 out of network, and chiropractic is capped at $35 out of network. So again, these are some distinctions that we like to highlight, very specific to out of network. So just to show all four plans compared to one another, as we mentioned, in New Jersey, the network is exactly the same. It is the Horizon Managed Care Network. So there's no difference in the available list of providers that are in network across all four plans. The national network is the same across Direct 10, 15, the Educators plan, but under the Garden State Health Plan, however, coverage is only in the state of New Jersey. As we mentioned, your primary care and your specialist copays vary depending on the plan, but are either going to be $10 for the primary, $15 for the specialist. And your annual physicals are also covered the same way with no copay if you stay in network. And in additional, your deductible and your maximum out-of-pocket limits are also varying whether you go in or out of network. Your deductible, which is the amount that you would lay out in a calendar year before your plan begins to pay, is $0 in network. So the moment your benefits begin, your deductible, there is no deductible in network. Out of network, you have different limits, whether it's individual or family coverage, as we have listed on the screen. Maximum out of pocket, however, is the most that you would lay out in a calendar year, whether it's in network or out of network. So again, the most that you would lay out in a calendar year, not that anybody is hitting these maxes, and I like to mention that, but your out of pocket max, again, in or out of network has different limits. And I wanted to mention this at the top of the meeting, but if you have any questions, please feel free to put them in the chat. And as we're going through the presentation, I will certainly answer those questions as they're coming in. Referrals are not required for any of the four plans that are available. Your labs continue to be the same with LabCorp and Quest as your in-network labs. Your out-of-network labs, should you choose to go out-of-network, would be subject to your applicable deductible and co-insurance percentage. Your outpatient surgery, again, covered the same way with no charge and 100% coverage in network. Out of network, you'd be subject to your applicable deductible and or co-insurance. And your emergency room copay varies depending on the plan that you choose. So if you're in Direct 15, it would continue to be $50. Or if you moved to the Educators Plan or the Garden State Health Plan, that would be $125. So we started talking a little bit about out of network, and just to get into a little bit more detail about that, the out of network table that is utilized under Direct 10 and under Direct 15 is something called Fair of Health. It is a generous reimbursement table for those out of network providers, whereas the Educators and the Garden State Health Plan utilize a different table, which is called the Medicare table. The technical name is the 200th percentile of Medicare, and that is the table that under both of those plans is used to determine what to reimburse those out of network providers. Because when you go in network, that in-network provider is contractually obligated to not bill you anything more than your applicable copay. But when you go out of network, those doctors can truly bill whatever they'd like. Anything above what is reimbursed under coinsurance is considered a balanced bill, and that would be your responsibility as the member to
Educators
reimburse
plan.
that
That's the one
provider.
I want to be
I'm
in.
sorry, if you
Yeah.
could mute yourself,
This is a
please. Okay, thank you. So as we were mentioning, it's important to understand if you're going in or out of network to a doctor. And if you are someone that is currently utilizing out of network benefits with a high degree of frequency, that's definitely a red flag to consider if you decide to stay, if you decide to move to the New Jersey Educators Health Plan. I can tell you that I spoke to a teacher, not at this district, but at another district recently that went out of network 3 times a week. And I told her this really is not a good fit for you because even though she was realizing a large savings, her high degree of frequency going out of network was going to eat away at those savings before the end of the year. So again, these are the things to think about if you're going in or out of network. I can tell you that as a person who is in this business, I do not go out of network. While out of network benefits are available to me and to you as well, the fact that I can't control my costs when I go out of network makes it a frightening prospect. If you are unsure if your doctor is in or out of network, reach out to us. We can certainly look up that doctor for you. But what we can tell you now is that whatever you are getting reimbursed back under Direct 10 and under Direct 15 is going to be less if you move to the educators or the Garden State Health Plan. If it's a doctor, for example, that you're seeing once or twice a year, most likely your savings will cover that and you'll still come out ahead savings wise. But again, seeing the degree of in which what frequency you are going to those doctors, that's something to really pause to consider. And just for example purposes, if you go out of network under, let's say, the educators or the Garden State Health Plan, let's say that provider bills you $100 for that service. Horizon will go ahead and determine what would have been the usual, customary, and reasonable amount allowed for that covered service, which would be that $50 there in the purple box. Horizon will then determine, okay, we will go ahead and pay our 70% of coinsurance, which is the blue box, and that's $35. You as the member would pay your 30% of coinsurance, which would be $15, which is in the orange box. But that red box, that other $50 that we haven't even addressed yet, that is what is known as balance billing. It does not get applied to your maximum out of pocket. So again, even though this is a small hypothetical example using $100, most likely when you're going out of network, you're probably going to a specialist that could be for a very costly office visit. So please make sure that you understand what your potential out-of-pocket expenses could be. You can also tell that out-of-network doctor to do a predetermination of benefits for you. They should be able to look up that information and be able to tell you, okay, based on your plan and the table of reimbursement, we would get X amount, leaving your out-of-pocket expense at this amount, and that would be something for you to consider to see if it's worth it for you to proceed forward. Someone is asking a question. Same networks in 2026 as in 2025 for the educators? Yes. In all 4 plans, the network of doctors is exactly the same as of this move. Right now in the state, your Direct 10 and 15 and the educators plan all have the same network. The Garden State Health Plan does not right now in the state. But once you move in January, all 4 plans will have the same network. And the person is saying, or should we be calling our doctors to see if there are changes? Surgery scheduled for 126. Currently, the doctor and hospital are in network. Yes, usually networks and participation in them are very long-term care contracts. Usually your doctor's committing for anywhere between 7 to 10 years in a contract with Horizon. So you can certainly double check with them. But again, if they approve that surgery, that means under Horizon now, they're going to approve it under this new plan because it's the same network of doctors, the Horizon Managed Care Network. Good question. So now that we'll get into prescription, if you are someone, and someone asked this right before the meeting got started, we do have the links on the IMAC benefits portal, but just to let everybody know, if you're in Direct 10 or 15, the list or the list of the formulary or the list of the covered drugs is called the classic formulary, which is classic formulary, public sector, and labor. And when you click on the links that are on the IMAC benefits portal, it'll have a drop down for you to select from classic formulary, or if you're in the New Jersey Educators Health Plan or the Garden State Health Plan, the formulary for members is the net results formulary. So you're either going to look at classic formulary, public sector and labor, or net results formulary. There's only two formularies to look at, and again, depending on the plan that you're looking to move into. So again, the educators plan or the Garden State Health Plan would use the net results formulary. You can go to horizonblue.com/pharmacy, and you can pick the appropriate list that you'd like to do some research under. And I can tell you that if it says not covered, that means it's not covered. I've been getting this question a lot lately with employees asking, if it says it's not covered, is there an appeals process? Is there a step therapy? If a drug is completely excluded from coverage, there is no appeal, there is no step therapy. If it tells you that it requires step therapy or that it requires prior authorization, you will see that listed on the formulary list there. So that's something to look at. But again, if you're unsure of how a drug is listed, send that over to us. I've been looking up so many medications for employees that no number is too big. I just looked up for an employee, not at your district, but at another district, who had 23 medications, and they wanted to see how they would be covered under the educators plan. Please send us your lists. We would be more than happy to write back to you and let you know what's covered, what's not covered, and what your copay could be, because this is the time to do your research and your due diligence before you make a plan change. At most, if you're making a plan change, you would be committing for the entirety of 2026. You'll have another open enrollment opportunity next year to make plan changes, but you do need to know that you are committing for an entire year. So please make sure that you do all this research ahead of time. Something else that I want to mention that always comes up around this time is people think that if they move from Direct 10 or Direct 15 and they move to the educators plan, that they can't go back. That is false. Everything is based on your date of hire. So as long as you were hired before July 1st of 2020, you can switch your plan every year during open enrollment. I can tell you that most people that switch from Direct 15 to the educators plan, they don't look back. The savings is so significant. The plan, they make it work for them. And again, with regards to prescription, there will always be a drug for every single condition. So there's never going to be a situation where, hey, if you have an inhaler, we're not covering inhalers anymore. No. It is a smaller list of covered medication, but there is a drug for every single condition in every therapeutic class of medication. Something else that we like to mention during this transition is that right now, since you are currently with OptumRx, if you have any prescriptions that are set up for mail order, you will have to go ahead and do that process through what's through Horizon, through what they use as their mail order service, which is Amazon. I'm sure everybody on this webinar is familiar with what Amazon is. So you would literally be submitting your prescription through Amazon Pharmacy to go ahead and have your mail order set up once your plan moves over as of January 1st. So again, that's something that we have the instructions on the portal. Reach out to us. We are here to go ahead and help you through any questions or setting up of mail order that you would like. And again, this is all the information that if your doctor's sending it directly to the pharmacy, this is how they would handle e-prescribe. But again, we can certainly walk you or your provider through this process. And for those of you in Direct 15 that are looking to potentially move to the educators or Garden State Health Plan, the copays for medication are as follows. Your generic drugs would be covered at a $5 copay. Your brand copays would be $10. What's called a non-preferred brand, this is where, again, we start getting into if the formulary is a little smaller. If your doctor writes Crestor on the prescription, Crestor is a brand name medication for cholesterol. Because there is a lower cost generic option available, Crestor is not covered under the educators or the Garden State Health Plan. However, its generic equivalent, which is rosuvastatin, that is covered under the educators and Garden State Health Plan. So Horizon makes it very easy with the links that they have available for you to search and definitively determine how a drug is covered. But again, you want to live somewhere where either generic or brand co-payments, because those are your covered drugs. I can tell you that the GLP-1 drugs that I've been looking at for members have all been covered. Ozempic, Wegovy, Mounjaro. While those drugs, as they do now, require prior authorization, they are covered medications under the educators plan in Horizon. So again, it's not that there are no brands that are covered, but they do have a smaller list. So again, reach out to us or follow the links on the IMAC benefits portal to see how your drugs would be covered. But again, just some highlights that we like to mention is the mandatory generics, which is a requirement of the plan. Step therapy, where depending on the medication, they may require you to try other lower cost options first before moving up the ladder, or the steps, if you will, in step therapy to that more expensive drug. And again, the use of a closed formulary, which in essence means that smaller list of drugs. Also in the prescription plan for the educators and the Garden State Health Plan, there is mail order, as there is with Direct 10 and Direct 15. The beauty of mail order is that you're paying one copay for a 90-day supply. So please make sure that if you are on certain maintenance medication like cholesterol medication, high blood pressure, even diabetes medication, that's something that you could set up through mail order and have it delivered directly to you. So again, something that we just like to remind members about. As we mentioned, step therapy is something that's applicable for the educators and the Garden State Health Plan. So again, something to consider depending on the medication. And when you are looking up those drugs on the Horizon formulary list online, it'll let you know if the drug requires step therapy. So next steps. Next steps would be if you if you don't want to make any changes and you made your changes already in Benefit Solver and want to continue those benefits as is, there is no action required on your behalf. If you are making a plan change or would like to make a plan change, however, you would need to complete an enrollment form or a waiver form if you're waiving coverage. We highly encourage everyone to use the IMAC benefits portal to compare all 4 plans across one another, and also to utilize that handy calculator that's available to help you determine your payroll contribution amounts. You can utilize the Horizon Doc Find link that's also on the IMAC benefits portal to look up participating providers. But as we mentioned, all 4 plans utilize the same network of doctors across the board. You will be eligible to switch plans again during next year's open enrollment. But again, at most you're committing for the entire year of 2026. And again, just as a reminder, the deadline to make any changes or waive coverages would be November 21st, and those changes would be emailed to Maureen, or you can drop them off if you'd like. The IMAC benefits portal, as we keep mentioning it throughout the webinar, is imacbenefits.com. The guest key is CWCBOE, all in caps, one word, no spaces. And as we said, every form, the calculator, plan documents, everything that you would need related to your benefits is posted on this portal. There is no personal health information here. It's just everything that's available for all CWC district employees. The calculator, which the new 2026 one looks just like this. This is the calculator that's available on the portal now. If you don't have Excel 2013 or later, please reach out to us. We will go ahead and run those numbers for you. If you are emailing us to get your contribution amounts, please email us your salary as well as your coverage share, whether you're covering a family, 2 adults, parent and child coverage, or single coverage, so we can respond to you and let you know exactly what your contribution amounts would be. And while this is a special enrollment period, you do have your annual open enrollment period to go ahead and make those changes. But while we understand that life happens outside of open enrollment, you now have 30 days to go ahead and make and complete any of your changes and submit your documentation to Maureen, with the exception of if you have a newborn. If you have a newborn, you have 60 days, and that is a New Jersey state mandate. Coverage is retroactive to the date of the event. But again, you have open enrollment every October with effective changes, with changes taking effect, on January 1st. If you have any dependent children that are aging out, they age out at the end of the calendar year in which they turn 26. At the end of that year, they have the following coverage options available to them under Horizon now. They'll be eligible for COBRA if they are under the age of 31 and meet certain criteria, which we will get into in the next slide. They may be eligible for Chapter 375, which is a New Jersey state mandate. And if you have special needs dependent children, please reach out to us because there is coverage continuation for them in Horizon with coverage continuation for overaged dependent children with disabilities. So as we were mentioning, Chapter 375, it is a much less expensive option than COBRA. COBRA, if you're familiar with it at all, is 102% of the premium. And again, very costly, whereas Chapter 375, if your dependent child is not married, has no dependent children of their own, are not entitled to any other group coverage or Medicare, and either live in the state of New Jersey or are a full-time student outside of the state, they're eligible to stay on until the age of 31 under the same plan for medical and prescription that you are currently on at a percentage of 60.8% of the cost. So it's a much lower percentage than COBRA. So if that is an option that is applicable to you, certainly reach out to us. I can tell you that I've been looking up some benefits for overage dependent children on the government marketplace or under the Affordable Care Act. And those premiums, as I'm sure you're seeing on the news, have skyrocketed. So this may be an option that would be potentially more cost effective should your child need to continue on benefits after they've aged out. So reach out to us, but we have links on the IMAC benefits portal as well. The Horizon Doc Finder, we have a link for this. If you go to horizonblue.com/Doctor Finder, feel free to go ahead and research any new providers, because again, any providers that you have now in network will continue to be in network. But if you needed to search up a new provider or look for a new type of provider, you would use this horizonblue.com search on Horizon's website to figure out how those doctors, if they would be covered or not, or in network or not, excuse me. With this transition, you still have Horizon BFIT, which is the gym reimbursement program. So the same rules continue to apply where if you go to the gym 12 days or more a month, or if you do your 10,000 steps a day, you can earn $20 a month up to $240 a year as a wellness reimbursement for participating in physical fitness. And again, you would have to go to the Horizon BFIT website in order to sign up for this. We also have a link for this on the IMAC benefits portal. And the last thing to cover would be the Horizon Blue 365. That would also continue as part of this transition. Horizon members continue to receive the same discounts now under the NJ Solutions HIF as they did in the state, so under Horizon. So if you haven't done so already, I highly encourage you to go to blue365deals.com and you can sign up for all kinds of neat discounts that Horizon offers to its members. That really wraps up our webinar. But again, some of the big takeaways is look out for those new ID cards, because whether you're making a plan change or not, everyone will be receiving new ID cards for both medical and prescription. Those ID cards will be mailed to you and in hand before the January 1st date. And after January 1st, please begin to present those new ID cards at your doctors and pharmacies. But if you are looking to make a change, you have until November 21st to do so. Brian, Maureen, Julie, is there anything else you'd like to touch upon before we wrap up?
Thank you, Liz.
Yes,
Brian.
yes. As Maureen said, thank you, Liz, very much. Very informative. Appreciate it.
Thank you, guys. No worries. And again, I highly encourage everybody to call and emails. I've talked to so many employees since last week, and it's great because everybody has different needs medically and financially. And while everyone would be happy with a savings, we want to make sure the plan is going to work for you. So it's not a one size fits all. Please reach out to us. I know people that have no issues with changing their medications. They want to make the educator's plan work. So that's something that we can certainly work with you to figure out what other drugs your doctor would be okay with you being on, and to see how those would be covered, and to see how your existing drugs would be covered. So highly encourage you to reach out to us directly, and we'll work with you in real time to get all those questions answered on your end. Perfect. All right, with that said, this wraps up our webinar, and I really appreciate everyone's time today and jumping on. Have a great rest of your day.
Thank you too, Liz.
Thank you.